right, let's hang it down. Put your booty back.
Those in this Parkinson community fitness program in Ohio know some of what Brett Favre is feeling.
If you can talk, walk, and chew gum at the same time, you've got a lot going for you.
Maura Granger has had Parkinson's for 5 years. She told us she is grateful Brett Favre is sharing his diagnosis openly.
That sharing allows more attention to be directed towards the disease and opens up opportunities for research and for prevention.
Her symptoms of this illness pretty common.
I felt anxious. I had a lot of physical stiffness.
The talk here today, however, also has been about Favre's openness about his previous football injuries on social media platforms.
He talks about how many times he has landed on his head and he couldn't see, he couldn't get up, and it was time after time.
Lisa Kors, the co-founder of this program, says we still have a lot to learn about what role this plays in Parkinson's disease.
And this head injury thing is really serious.
Dr. Alberto Espe, a neurologist and the director of the Movement Disorder Center at Ohio's UC Health, says Lisa is right. Repeated head injuries have now been linked to movement disorders such as Parkinson's. Nobody is quite sure why, but the National Institute of Neurological Disorders and Stroke says Parkinson's symptoms are caused by nerve cell degeneration in the area that controls movement. These cells become impaired and reduce an important chemical in the brain called dopamine. How blows to the head contribute to this is an important area of research. And what's linked to your diagnosis also may play a role, Dr. Espe says, in treatment.
It's not what you have, but why you have it. And the why you have it is only going to apply to that one person.
In the meantime, this group has a word of advice for Brett Favre, too.
Parkinson's can really isolate people, and because it's such an individual condition, you feel quite alone.
So they say find your support system. Everything is easier when shared. One thing really important, early diagnosis. So if you are noticing any of the symptoms those in our story mentioned, it is suggested you ask your doctor for a referral to a neurologist.
From breaking news to feel-good stories, Local 12 has it all. Tab subscribe and click the links for more content like this.